Hi, everyone. I'm Mandy Cohens, Secretary of the North Carolina Department of Health and Human Services. And I want to thank you for joining the 10th Annual North Carolina Child Hunger Leaders Conference. Throughout this pandemic, children's health and well-being has been an utmost priority for my department and Governor Cooper's administration. Now, we know there's so many benefits to in-person schooling, from educational and social emotional aspects to the very practical benefits such as reliable nutrition. It has been challenging work to ensure that these resources were not lost due to the pandemic's restraint on in-person education. And I want to thank all of education's first responders, especially our school nutrition and student transportation heroes who have stepped up and served our children through every challenge. Your work has been truly heroic. From the outset of this pandemic, you were often the first to model the use of PPE and the 3 Ws for your local communities. Your leadership and example have been critical in the fight to protect our children from the effects such as long-term public health crises. I also want to specifically thank the local school nutrition directors and their teams who provide a critical safety net for families with young children. This important but difficult work has only become more challenging and more vital as a result of COVID-19. So thank you. Thank you for your dedication and resilience. Coordination between my department, Department of Health and Human Services, and the Department of Public Instruction has been absolutely critical in the fight against this virus and in keeping North Carolina children fed throughout this pandemic. DHHS and DPI partnered to get out the pandemic EBT nutrition benefits to 900,000 children who rely upon school meals, and to provide hundreds of millions of dollars in FNS allotments. DHHS has launched additional human service food programs as well. For example, North Carolina was one of the first states to implement an online food and nutrition service purchasing through marketplaces like Walmart and Amazon. We've also implemented numerous flexibilities and waivers in response to COVID-19 and created online DSNAP resources as well. These are just a few of the examples of the monumental effort that has been undertaken to ensure that no child in North Carolina goes hungry. This pandemic has greatly increased food insecurity across the United States, and we are tackling this challenge head on. Thank you for partnering with us to that end. I want to close this morning by looking ahead. At DHHS, we're working hard on vaccines across the state, and we've worked very hard to ramp up that process. But we know that supply of vaccines is very, very limited. Right now, we are vaccinating healthcare workers and adults over the age of 65. The next group to become eligible are our frontline essential workers, which include K-12 teachers and support staff. Everyone has a spot to take their shot, but it's going to take some time before we can reach every North Carolinian. You can visit yourspotyourshot.nc.gov to learn more, stay up to date on the vaccination process in our state. I know that waiting on your vaccine can be frustrating, but as we all practice our 3 Ws and avoid gatherings with folks we don't live with, we will make it to the other side of this crisis, I promise. After a year of pandemic response, we know what to do to protect our loved ones and to save lives. Thank you so much for the part you play in this important work. I am deeply, deeply grateful for your partnership and honored to serve North Carolina alongside each of you. Enjoy the remainder of the conference and stay well, everyone.